Hey guys, Ryan here with Advanced Physical and Aquatic Therapy. I want to share with you today a conversation that I just had in clinic with a patient. And I think I get this question a lot and I feel like it needs to be addressed. And it comes to me from a person who is complaining about back pain. So you have back pain, you've already been to physical therapy maybe a couple times, maybe it was or wasn't the right place to go. Maybe they didn't progress you as well, or things kind of just fizzled out when you went there. But you have seen a physician or an orthopedic surgeon, and they've recommended, based on your MRI findings, that you have a herniated disc at this level, you have all this arthritis, you have the spine of a 90-year-old, and those words indoctrinate you, because it's coming from a doctor, which I believe that's where that word comes from. That surgery is going to be the only thing that helps your pain. And what we are finding out from research and just modern knowledge of how our healthcare system does things and doesn't do them well, that back and spinal fusion and surgeries don't really work very well with back pain itself. We find out that at the very best, it's a giant placebo effect, and that the things they do work well with is if you have a long history of significant pain down your leg that doesn't go away, like numbness, tingling, aching pain down your leg that's so life-changing that you need the surgery to get that pain gone. It does help with that leg pain, but it doesn't get great results with reducing long-term results of low back pain. And I hear things like, it hurts me when I stand 10 out of 10, but when I sit down, it feels better. Or when I'm in the pool, it feels better. Or when I'm lying down, it feels better. Now, if it was truly spinal pain, you wouldn't have those changes in symptoms. You would have pain all the time, off and on, no matter what position you were in. That's telling me that with movement and things, because over time, if you walked for a long period of time or stood for a long period of time, you get more pain. That's telling me it's a strength issue. It's a possible flexibility and strength issue. So your muscles are breaking down because they're not strong enough to sustain that activity, and therefore your pain goes up. Now, no spinal surgery is going to fix that. So hopefully the word gets out there, and hopefully our healthcare system is educating people in the right way that these surgeries aren't a good thing. And if your mindset going into physical therapy is that it can help me, at least you're opening the door that it will help you. If your mindset going into physical therapy is this surgery is the only thing that's going to help me, and just try physical therapy to see if we can stave it off or avoid it, but it might not work. That's not ever going to be a positive situation. You're not going to see the results in therapy if you're mentally not prepared for it, if you're mentally not going to see the benefits. Our brains have a way of doing that, getting blinders on and not seeing the benefits, and then eventually getting the surgery, and we see people down the road that the results aren't as great as they thought they would be. So I hope that helps. I hope we're shedding light in a positive way of how we can help people the way that is most natural and non-invasive. Take care, guys. I hope that helps.